Hello, my name is Phoebe Campbell, and today we will be discussing educational ways to prevent hypertension in the Shadowville community. The goal of this lesson is for learners to be able to manage and measure their blood pressure with understanding the need for antihypertensive medications, as well as lifestyle adjustments that can be made to improve a person's high blood pressure. The three objectives for the lesson are identifying lifestyle changes needed to help manage blood pressure, measure and understand the ranges of low, normal, and high blood pressures, and understand the importance of medication compliance and identifying signs and symptoms of low and high blood pressure. Objective 1. By the end of this lesson, the learner will be able to identify lifestyle changes needed to help manage their blood pressure. When speaking on lifestyle changes, you would want to stop smoking and excessive alcohol consumption, reducing stress or stressful situations, remain compliant with medications, and have regular monitoring and recording of blood pressure readings at home and with a physician. Diet is a big part of helping reduce and control blood pressure. Consuming a diet low in sodium and diets high in fat and saturated fats should be avoided. These diets can increase the risk for high cholesterol and hypertension because if you think about it, cholesterol plaque and calcium plaque build up, causing arteries to become hard and narrow. So your heart has extra strain added onto it, making it much harder to pump blood through them, thus increasing your blood pressure. Objective 2. By the end of this lesson, the learner will be able to measure and understand the ranges of normal, low, and high blood pressure. The normal blood pressure for an adult is 120/80. High blood pressure is anything over 140/90, and low blood pressure is anything less than 90/60. When measuring blood pressure, body positioning is important. You should not take your blood pressure with your feet dangling or your arms or legs crossed. You should be sitting in a chair, both feet on the ground and in an upright position. Blood pressure should be taken on the left arm because that is the side the heart is on. This would give a more accurate reading, and the appropriate time of day to check your blood pressure would be the first thing in the morning after using the restroom, and 30 minutes before eating or drinking or taking any medications. You should also check your blood pressure after taking your medication to make sure the medication is effective, and periodically check it throughout the day. Your doctor may ask for a log on your blood pressure throughout the day over a certain period. This log is important to make sure medication is doing its job properly and to maintain a normal blood pressure. Objective 3. By the end of this session, the learner will understand the importance of medication compliance and to be able to identify signs and symptoms of low and high blood pressure. Low blood pressure can have many symptoms and different amongst an individual, but the main symptoms can be blurry vision, dizziness, in which we worry about the risk for falling and injury, fainting, lightheadedness, and weakness. Medications like Midodrine are given to people with low blood pressure or hypotension, to increase their blood pressure. High blood pressure, on the other hand, can cause headache, shortness of breath or difficulty breathing, nausea and vomiting, feeling anxious or like your heart is beating really fast, which can increase your breathing rate and also make you feel short of breath, and even chest pain. Maintain and comply with antihypertensive medications is so important to maintain blood pressure. Staying on a regularly scheduled medication can maintain and even improve blood pressure over time. So, with these lifestyle changes, diet changes, increased exercise, and education on ways to adhere to medication, all of these things can reduce one's risk for having high blood pressure and help one dealing with it. It is important to teach education and give proper resources to people unable regularly to see physicians. Please see the short 5-question quiz in the comments to test your knowledge on blood pressure. Thank you.